Hello and welcome to another episode of In Conversation with by Kangaroo Minds. I'm Vedika and today we have with us Joe Morton-Brown. Joe is an emotional health practitioner who works with schools, especially with young people, parents, teachers, and staff, as well as other mental health professionals. She is also a counselor, a mental health trainer, and the creator of the Flourish YouTube channel, where she regularly puts out content aimed at young people and students to help support them with their mental health. Our conversation with Joe today is going to center around the mental health of children, especially in the context of the school closures owing to the coronavirus pandemic. Before we begin, however, I would like to put a trigger warning for our audiences. If at any point during this conversation, should you find yourself feeling triggered or distressed, we urge you to take a step back and look after yourself. Should you need any additional support resources, you can also find them on our website. And now, without taking up much time, we're going to dive in to hear more from Joe. Joe, welcome to the conversation, and it's an absolute pleasure to have you with us today.
Hello, thank you for having me. Thank you.
So, Joe, I know you've done a lot of work, around not just school education pre-COVID, but also you've been putting out a lot of things after COVID. And, what have been some of the things that you've seen or you feel are going to be the short as well as long-term implications that these school closures are going to have on children?
I think that's such a good question. I think that what we have to do is we have to actually acknowledge that, with young people and with adults, but with young people, having 2 years at least at the moment out of kind of mainstream education for some people, because I know obviously schools aren't in India, they're not all open, are they? Not all.
No, so we've been in phases, and I think the biggest challenge, which even you might have seen in the UK and a lot of other countries are seeing as well, is you have a new variant, you have a new version, another lockdown comes along and children are back in that uncertain phase. So that's it.
And I think that what we have to do is we have to recognize that actually what's been going on for children and young people is that they've not had that consistency with their education and their learning. But more importantly, they've not had that interaction with their friends, going to school and being able to play. And I think sometimes that's what children need the most, is to have that, for the younger ones, to play, like to have that imaginative play at primary school. And then at secondary school and high school and sixth form and college, is to have those interactions with their friends where they can support one another, make one another laugh. And I know that we live in very much online as well. People have more friends online sometimes, but that's not what life is. Life isn't about having a friendship, all our friendships, through a camera, through a telephone. And I think that is what is kind of one of the long and the short term impacts, is that kind of lack of interaction, socializing, being able to have conversations and just be with another person.
Right. I think, that's a very valid point in terms of, like the whole social emotional learning aspect which children are missing out on in terms of COVID. So do you want to tell us a little bit more about the role which schools play, especially when it comes to this?
Yeah, so schools are, if you can imagine a child, I'd like to think so, they're a safe place where they get to go to school and they get to learn, which for some of them is the most boring part, but it's their place that they go to and they are safe there. What children and young people don't realise is that whilst they may dislike school, deep down there is this love for school because there's rules and there's boundaries. So actually they love the fact that they've got a school uniform to wear because they're equal. They love the fact that there's a fence and a perimeter that goes around the school, that fence, to keep them safe. That there's consistent, boundaries with regards to behaviour, because it is all of these, behaviour policies in line, and the rules is to keep the child safe. And I think that having that for children is so important. And I think that actually what we have to do is we have to kind of remind ourselves that what children have been going through with kind of on-off school or partial school closures is them not necessarily having that sense of safety to go to, because for children, not always do they have their home as their safe place either.
Right. I think, you made a very valid point, about school being a safe space. And, that brings us again to another thing you touched upon about like home not being a safe place for everyone. Like I know when the pandemic started, one of the things people emphasized was, that don't look at it as if you're stuck at home, look at it as if you're safe at home. But that's unfortunately not a reality for a lot of people. So how do you think school closures particularly impacted, number one, children who come from abusive households, as well as children who might have special learning needs, which their household might not be able to cater to?
I think that's such a good question, because it's so hard to know what goes on behind closed doors. And I think we'd all like to think that children and young people are safe at home, but the reality that isn't the case. And I feel for some children and young people, yes, we have got, what they've experienced or what they've seen. But also I think that if we can try and turn that around onto a positive, and for them to recognise the strength of actually, getting through a pandemic when somebody has poor mental health, having to do home learning and remote learning when actually school life isn't just tough at the best of times with their educational needs, but actually they're struggling even more so because they're on their home. So I think that if we can have this ability to recognise just actually how hard it is for all students and for all pupils, but especially those ones that really need that contact, that support, and that kind of encouragement, I think will allow us to recognise that it is going to be harder for them. It's certainly those children and young people and adults, that have poor mental health at the best of times before the pandemic, and certainly with somebody with depression, for example, where their chemicals in their brain is just at an imbalance, let alone with events that's going on in life. So I think that it is quite easy to kind of see the difference, but it's also, if we can try and get young people and children and adults to recognise the difference of, you got through this stage in your life through a pandemic, and kind of just try and highlight the strength and how resilient they are, will actually possibly allow them to just see it a bit differently.
I think that's a very interesting part that you mentioned, bringing about the whole mental health aspect, that, there were people who were struggling pre-pandemic as well. So it's not that mental health concerns are new, it just might be that now you may have more students having mental health concerns post the pandemic. But again, can you tell us a little bit, what have been some of the mental health implications that you've seen, that have come up owing to these school closures, and how are we starting to see that play out?
So I think that we have to bear in mind that there was already a report by Childline, which is a UK charity, and kind of a few charities had done their own surveys, but it was saying actually how adolescents actually were quite a lonely generation. So we have to recognise that before the pandemic. But what we have got to do is, if we think about the pandemic and what it's brought, is that it has allowed children to kind of, and young people kind of struggle to find their identity, I think. Some people that have anxiety would have loved having a lockdown, because there was this ability where they didn't need to face the world. They didn't need to face school.
Right.
So whilst that was great for people that had anxiety disorders or just a high level of anxiety, that was a relief, because they didn't have to go out of the house. They didn't have to face the world. However, what's happened over time is that that's just kind of conditioned themselves thinking that I'm safe at home. And I think that for me, we used to call them, and I hated the term, school refusers. And what a school refuser used to be is somebody that would have the best intentions to go to school, but would struggle to turn up to school. And that's why I hate the word school refusers, because they're not refusing to go to school. It's just that school's too hard to go to emotionally. So now we call it emotional-based school avoidance, which I just think it sounds so much better. But I've certainly found that that's been on the rise compared to before the pandemic. I found for some young people there's been more self-harming. So it's that negative kind of way of not knowing how to cope in life, where it all gets just too much that they don't know how to cope with that. So I found that that's also been on the rise. And I think that you have to bear in mind that self-harm and eating disorders are a sense of wanting to take control. And I think that what I believe and what I've seen professionally is that there's been a lot of young people that have developed poor eating habits, so maybe an eating disorder, or kind of coping with the way of self-harm in order to maybe take control of their lives because they can't control a pandemic. So that you have got to kind of try and understand in a way of why that's happened. And I think test anxiety has been a really big one. You know, when these children and young people are being tested at school, that this huge amount of anxiety that comes with it. So yeah, there's just a few to kind of, just a few to know.
I think it's interesting that, you mentioned test anxiety because, again, coming back to, social emotional learning, when we've spoken about school closures, so much of the focus tends to have been on, like this loss of academic learning that, children are not able to read, or their writing skills have deteriorated, or their math skills are poor. But if you could tell us a little bit more about the test anxiety, and do you think there's been an impact on that as well, keeping in mind the pandemic?
Yeah, I think that what we have to consider is that, and I went to my little boy's parents' evening the other day, and, it's so easy, whilst we sit there wearing our face masks, to kind of just be living in the here and now, which is great. But we have got to identify what we've been through, because certainly for life here in the UK, it just seems so busy. Everybody's too busy. It's just crazy. But I think we have to actually just stop and, like I said earlier, reflect upon actually what we've gone through. And you're right, handwriting isn't going to be great, or for some children, their spelling isn't going to be great. So it's different for different children. There will be a gap, and it will be different for every child and young person. But with exam anxiety, with test anxiety, is that we almost want, I'm going to sound a bit mean here, but we almost want our pupils and students to feel stressed. We want them to have that certain element of anxiety, because that's good. That will allow them to stay focused. That will allow them to recognize that they need to revise, that they need to be prepared. However, what can happen is too much of that stress, too much of that anxiety is where it can actually affect their ability to concentrate and to actually perform in an exam. So it goes from just that healthy amount of nerves that I know when I was at school, it was years ago now, but when I was at school, feeling nervous, and that's natural. And when we talk about test anxiety, I'm not saying that it's never not been there, because it has been there before.
It has.
But at the moment, obviously, it's got a name, so people are going to be using that. So that's a big one. But it's just because it's just getting too much. And what you have with tests and with exams is you have this ability to get a grade which is considered a good grade or a bad grade. And I think that for way too many students and pupils, they see that as pass or fail.
Right.
So, and it's trying to get them to realise that actually, if you've failed, that doesn't necessarily mean that it's the end of the world. It just means that we need to try and improve for next time. But obviously it can just have a domino effect, because it's not just one it's not just one exam that they're going to sit. It's going to be a cluster of exams, GCSEs or A-levels. I'm not too sure what they are in India, but yeah, it's just recognizing that just for some students it's just too much. They may feel panicky in an exam, and that anxiety can maybe bring on a panic attack.
Right.
And again, it's natural for us to react in these ways, but unfortunately our brain will just make it so much worse, because it thinks that we're in danger, and what if this happens and what if that happens, that it just makes it so much harder for us to concentrate and to simply be there and then, if that's in the test or the exam.
I think it's quite interesting because, when you mention students looking at grades as just merely, like a pass or a fail compartment, one of the things that also happens is a lot of times students attach that grade to like a sense of self-worth, right? You feel that I'm not good enough, I'm not smart enough, and that grade they take it on as a parameter to define themselves. But moving forward, I think another thing that came up was, like emotionally based school avoidance, which was earlier, as you said, people who refuse school. But this is not something new. Again, similar to test anxiety, it has been the case even before COVID. So what do you think are the reasons that, so many young people struggle to go to school?
I think that's such a tough question because it's so different for so many young people, as you can imagine. Part of my job is working as a counsellor and I'm based at a school. So for the students and pupils that I've worked with, there's been this certain element of just fear of what other people are thinking of them. So low confidence and self-esteem. There's this fear of getting the work wrong. I think that's a big one, fear of getting the work wrong. There's this fear of what their friends might be thinking. Then you've got other students and pupils on a completely different scale and is, about they feel so anxious that they feel sick, that natural feeling again of nerves. But they're so worried, what if they are sick? What if I am sick? And they've therefore got this fear of being sick. Same as panic attacks. People are worried about, gosh, what if I was to have a panic attack at school? And it can just make it so much worse that, guess what? It can bring on a panic attack because what we think affects the way that we feel. So we have pupils and students, and this is a fact. If you have a pupil or a student that's waking up in the morning and I don't want to go to school because today's going to be a bad day, everything bad's going to happen, then they're going to make it so much harder for them to actually have a good day. So it's just about recognizing the way that we treat our mind. And that's why certainly on the YouTube channel, I'm always trying to encourage kids and young people, be kind to your mind, because there is just so much going on for them. And then I think for us adults, it's hard for us adults, parents, carers, if you're in the profession of looking after other people, nieces and nephews, just being around other people in a pandemic or day to day can also be quite tiring.
It can be. And I think, another thing is, okay, we're going to talk about school reopenings. And I think a big part of that conversation has been how do you feel that, teachers and parents can better support students into easing that transition back to school?
So for me, there's this quote, and the reason that I always say this quote is for somebody that works with children and young people, so a teacher or just, working at a school or a college, is that every interaction you have with a young person is an intervention. And I deliver training, and I have so many people that work in schools and educational settings that are, Joe, I need to go on a course because I need to find out how to support these people with mental health. The truth is, and I'm not putting myself out of a job here, but the truth is you don't need to necessarily go on a course. You just need to care. And that's why I think it's so important that when we are interacting with children and young people, that we recognize that just that smile, okay, and I'm talking basics here, a smile, a hello, a compliment, are so powerful to help motivate these pupils and students, that actually that's one of the biggest things. I also think, and I'd kind of put that under the umbrella of this, professional love, showing that you support your students and pupils. And then as a parent and a carer, I think that it's just about us recognizing that, yes, we've all been 14 before, but we have never been 14 years old in a global pandemic. And I think that if we have this ability to just recognize how we're not going to understand how it is to be them, no matter how much empathy we have, we're never going to truly understand how it is to feel for them. But it's about having that ability to empathize and recognize that actually, do you know what? I can sense that you're really snappy and teary right now, so I'm just going to let you have a couple of minutes and then I'll come back. Just having that level of understanding, and kind of small steps, I think, as schools reopen, is that it is about kind of just those small steps forward, realizing, certainly here in the UK, it's a bit different for us, but we're out of our restrictions now, but when we did, it was teaching, where the teacher had to stay at the front and students had to be all in rows. You know, that's not what teaching is about. Teaching is about interacting. Teaching is about the teacher going in and around the tables.
Right.
So teaching had changed. So it's affected different people on different levels. And I think that as parents and carers, it's very easy to feel helpless because we can't make it better for them. But what we can do is we can just be there to support them and be there to listen to them if they needed us.
I think that's a very interesting thing, right? That there's not much any of us can do, but it's just sometimes more about like being there, like listening, just showing someone that, I may not completely get what you're going through, but I'm going to be here to support you through it. And that reassurance can really help students in the transition. But speaking about, the return to schools, and as you said, in the UK, students have come back to school. What have been some of the challenges that have come up, as a result of like these long school closures that you all are now seeing?
I think the biggest thing is tiredness. And that's not just because they're having to get up and come to school and they're not used to that. I think the biggest thing, because obviously our schools reopened on and off, but mainly we've been open about a year now. March 2021 is when schools reopened. But, we've been having them in an RM with the bubble closures and things like that. But I think that even now, so many months on, that children are, they need the holidays, they need the breaks because they are so mentally exhausted from learning. I know that with some schools, they still work in bubbles. And I think that my biggest thing is I think children, when they have been to school and they are in that bubble of that class or that year group, I think I can recognise that they're getting, how can I say it in a nice way? They're getting bored with being with their own class and not mixing with other children. So I think that whilst they've developed maybe skills to socialise with their own age group, it does concern me that they've not necessarily had the ability to mix with older and younger years. So certainly kind of primary school, those year sixes being able to kind of, so 11-year-olds being able to mix with the first year ones, which are about 4 or 5, just having that ability to adapt to people, I think has been one of the biggest things as well. So, and it's just kind of allowing them to emotionally catch up as well. It's about recognizing where they're at emotionally, not just academically, but emotionally maybe as well.
Right. So, interestingly, we saw that, when the children picked their word of the year for the year last year, what the word they chose was anxiety. So what would you say have been, your thoughts around that?
I think with anxiety, the word anxiety is very much, it's used often. But actually it has different meanings. Now, working as a psychotherapist, for me personally, I want pupils to have this certain level of anxiety, that healthy anxiety, which might also be known as stress and worry. That's going to be in life. We can't rule out anxiety. I can't make things not happen that a child doesn't feel anxious, feel worried. But what we can do is we need to recognise that there is a difference between a healthy amount of anxiety, like I said earlier, and then severe anxiety. Because what happens with that severe anxiety is where people may develop an anxiety disorder. And there's lots of anxiety disorders out there. And I know you put a trigger warning to this video, which is good, because those anxiety disorders could be obsessive compulsive disorder, panic disorder, separation anxiety. So there's lots of different types of anxiety disorders out there. But it's when I hear that word anxiety, it's just like, the difference between, I just wish, I suppose, that there was a different word for anxiety, that word of the year, and for those people that have an anxiety disorder.
Right.
Because people that have an anxiety disorder, their anxiety, it is off the scale that they can't go to school, they can't leave the house, that they're scared of meeting people maybe. So I just wish that it had a different word. But I think that we just have to recognise that society nowadays, we are a lot more self-aware, and actually I think that that's a really good thing, you know, that we are able to identify, do you know what, I'm feeling really anxious and this is just a bit too much, which is good. But I would love for children and young people and adults to have the ability to not only recognize it, but to do something in order to help themselves.
Right. And I think it's very interesting thing that you mentioned that, you know, we wish we had a different word for anxiety, which represented that, you know, everyday feeling, because we see it very often that, you know, mental health terms like depression and anxiety tend to be used very synonymously with just being, you know, that regular feeling of being stressed or that generic day-to-day worry. Or we'll see depression being used with a low mood or just feeling sad or having a bad day is not necessarily depression. But, you know, till we get a lack of like that understanding needs to come about that these words are not to be used interchangeably. And frankly, I've seen a lot of times where even within classrooms, teachers will use it interchangeably or tell students when you're studying English that, you know, don't say I'm feeling sad, just make it I'm feeling depressed. But that term carries with it so much weight, right?
Yeah. And I think that that's why, so I do a lot of school assemblies, and when I do those school assemblies, like one of my key messages is that it's okay not to be okay.
Mm-hmm.
Like, I know it sounds cliche, but life isn't always going to be, you're not going to have a good day every single day. So yeah, my assemblies are about, it's not, you know, it's okay to not be okay. However, it's not okay if you're not prepared to tell anybody about it. That's the most important thing whenever I do one of those assemblies, because I want students and pupils to recognize that happiness isn't found in every single day. And I think that if we can allow children and young people to practice gratitude, then what will happen is they will look and they will find those good little things every day. So it's just about working at it. I love this quote: the happiest of people don't have the best of everything. The happiest of people make the best of everything. And I think that if we can empower our young people to have gratitude, then they will start to recognize that actually happiness isn't a place. It's, you know, it's not a destination, it's a journey. And also it's about finding those little things every day that will bring you happiness.
I think, you know, also moving forward, like, you know, how do you think schools can better support the mental health of not just students, but also, you know, faculty and parents as well, like, you know, both pre-COVID, like keeping in mind COVID, but also in the long term?
I think that with schools, they've got a really big part to play. And I think that, you know, there is so much that's changed over the decade. Parenting has changed a huge amount. Teaching has changed in a sense of the delivery and in a sense of approach, you know, with regards to discipline, for example. But what we have to recognise is that actually in a school, for me, I would love it to be almost like a mentally healthy school where the students can go to somebody, the pupils can go to somebody if they feel worried or sad. Because if we can allow them to have that safe person that they can go to, you know, a problem shared is a problem halved. It's not quite as good as that, but it's close. You know, the thought of actually getting somebody to share a worry can actually just allow you to feel a little bit lighter. And I think that's the most important thing, is allowing schools to have this open door policy, the staff being approachable. Then that child isn't on their own quite so much, because they have got somebody to go and offload to. And I think that we've been doing that. I think that we have been moving in the right direction, which is quite nice to know.
And that's definitely helpful, you know, like just having someone around, or, you know, schools sort of promoting the message, as you said, that it's okay not to be okay. And, you know, you can do something about it. You don't have to feel that way throughout. I mean, just that little message of hope sometimes can go such a long way, especially with younger children. But coming to, you know, now post-COVID, we have a lot of these conversations around this whole idea of the new normal. So what is something you would like to see happening more of in the new normal?
That was a good one. I would just like for everybody to be able to, so somebody that was sensitive and I was always a sensitive child, and I used to be ashamed of being sensitive. I used to be embarrassed of being a sensitive child, but actually now I think it's quite a good thing that you're in touch with your emotions. But I really would love to keep on moving in the right direction, that it's okay to talk about our feelings. It's okay for boys to cry. It's okay not to have to man up, and all those old words, I would love for us to be able to show our emotions, and that if you're feeling sad, then you can be honest. And I'd love for boys in particular to be able to be more of their true selves, rather than I mustn't cry, I shouldn't cry, or I should be strong and I should be tough, because it's a hard world to try and do that, especially being mentally healthy is about allowing children and young people to talk openly about their feelings.
I think you made a very valid point there as well, right? That sometimes when we use the word resilient, and I think this has been like a theme throughout the conversation that we've had, is that we tend to focus a lot on, okay, you've gotten through this, but the word resilient shouldn't necessarily mean that, you should be proud that you didn't seek help, or, that you didn't break down, or that, you're not sensitive, because somewhere I think within the term resilient, we don't leave too much scope for people to be vulnerable or talk about their feelings. So I think that's definitely a new way we need to look at resilience. But, Joe, just to wrap up the conversation that we've had today, what would be, your parting words to anyone who's having a hard time with their mental health right now, who might be watching this, listening to this?
So my biggest thing is not to suffer on your own. Feeling sad, down, blue, possibly depression, is extremely hard. And life is already hard. Life is already hard, just being here. That actually, if you could have somebody that you could trust and go to, then reach out and let somebody in, because happiness is something that you're entitled to feel. And that for you to get through this, and I love the word hope as an acronym, hold on, pain ends, because what you have to do is you have to reach out and recognize that you need the support, but you also need to be prepared to do something about it. My biggest thing is that unless you're prepared to try, nothing different is going to change. So it is about making an effort. And if that is, when you get up in the morning, making your bed, so then you've achieved that instant, achievement, first thing before you've even walked out of your bedroom door, then do it. If it's kind of just reaching out and being able to speak to somebody, then do it. But it's just making sure that you don't struggle on your own.
No, I think it's been a really, informative and enriching session. So thank you so much, Joe, for taking out so much time and, joining us today and sharing all your wonderful insights. I think there's a lot to learn for all of us from this. And I think, we can take the learnings that we've had in the 2 years moving forward as well. So, and lastly, for anyone who's watching this right now, if you're having a hard time with your mental health, please know that it gets better and you deserve to feel better. So there is help out there. So please look after yourself and reach out. And for anyone who you might be worried about, sometimes just check in on someone as well. We never know what anyone is going through at this time. So till next time, please stay well and stay healthy. Thank you.